Thanks for being with us today. I'm Nate Eaton, and today we are talking with the COO of the new community hospital. This is Casey Jackman. Casey, a lot of people have seen your hospital being built near the other two hospitals.
Yeah.
You're getting ready to open, or by the time you watch this, you may be open. Tell me why there was a need for a third hospital here in Idaho Falls.
It's a good question. Idaho Falls is a growing progressive community, and it attracts a lot of new people. So we've had a lot of influx of people into the area. The two hospitals that have been here before have been fairly busy, but even more than that, we've seen people in the community, people in Southeast Idaho, looking for a different option, looking for an alternative, just a different place to have available, right? And they've been asking for quite a while for a different option, and we feel like the service lines that we're going to offer in conjunction with what Mountain View currently offers provide a good alternative in this area.
So are you kind of partners with Mountain View then, or?
We are. Mountain View Hospital has been around for about 17 years. They've been very successful at doing the things that they do. But being a physician-owned hospital, they have some federal limitations placed on them for opportunities to grow. So ideally, they would have been able to expand to offer all of the service lines that we're going to offer at Idaho Falls Community Hospital. But with those limitations in place, they just don't have that opportunity. That's why we exist.
I see. All right. So something like another ER.
Mountain View has the capability of expanding into whatever service line that they would want to, but they'd have to sacrifice something that they already have. And with those federal limitations, to be able to do it in any kind of significant manner, it's just not a viable option. So if they wanted to open up an emergency room, it would be incredibly small and not very helpful. So if it's going to be offered at any kind of viable scale, it needs to be a separate entity.
And community hospital will have an emergency room?
Absolutely. We'll have a 22-bed emergency room, fully capable of taking care of whatever walks through the door. Now I want to be very, very clear on this. There is a perfectly good level 2 trauma center here in town. And a trauma center designation is a hard thing to get. But there's a lot of other emergencies that would be appropriate to be cared for in a lower acuity trauma center.
What are some other services or departments that community might have that Mountain View doesn't have right now?
Mountain View has a highly focused surgical presence. The vast majority of those surgeries are planned and elective, right? You can decide, hey, I need to have my shoulder fixed. I'm going to schedule this with my doctor. Idaho Falls Community Hospital has 3 well-equipped and highly specialized operating rooms that are available to take care of whatever comes through the emergency room. We also have plans on growing those capabilities into different areas where we can take care of more acute patients. There's a lot of great healthcare that happens in this area, and there's a lot of great healthcare that happens outside of this area just because people are looking for an option, and we want to keep those people here where they can stay close to their family, where it's easy for people to visit them, and where they can see the good physicians of this area that take really good care of them. But maybe just need a different option to be seen in a different place.
One of the things that I've heard, even before moving to Idaho Falls, is, if you need anything major, you've got to go to Salt Lake or you've got to go to Boise. Do you foresee the day soon or within the next 10, 15, 20 years where that won't be the case, where pretty much anything, heart transplants, severe traumas and burns could be dealt with locally?
I think absolutely. You've got some, as I mentioned, some very well-trained, good, compassionate physicians in this area that want to further the medicine that's available in this area. And, I think a good hospital exists to help those physicians safely expand that offering. You've seen less and less leaving this part of the state going to Salt Lake. But with the hospitals they have down there, with the population down there, those areas are always going to be more advanced than us. But yes, absolutely, I see lots of opportunities for us to be able to look to the future and offer things that aren't currently available here in town.
Tell us a little bit about your background.
Well, I'm an Idaho native. I grew up in Burley, Idaho. Did a little bit of education outside the state. Came back here and went through some schooling at ISU for medical imaging. I'm an old CT, MRI, nuke med tech, and have worked at a lot of different hospitals. But I spent some time, almost 12 years, at Mountain View Hospital, and it's the most different place that I've ever worked. The culture there is, it has to be experienced. And unfortunately, some people have gotten to experience that as patients, but to be able to work in that kind of atmosphere was something that I'd never experienced in all of the rest of my career, including owning my own business. They did it better than I did. But I spent almost 12 years at Mountain View Hospital in different roles, managing different departments and different areas of the hospital. And when they decided that this was a good opportunity for Idaho Falls, I had an opportunity to jump ship and try and recreate that culture at Idaho Falls Community Hospital. And that's what I've been working on for the past 18 months.
Over your career, have you noticed that patients' behavior has changed? For instance, when I go to the doctor, I'd love to email my doctor, or even text my doctor, or get results right now rather than having to wait for labs. I mean, as the world has changed, are you seeing that in medical care as well?
Patients have become a lot more educated in their own care, and that's a good thing.
Could be a bad thing depending on those websites you go to.
It could be. Yeah. It could be. Educated with the right materials is a good way to go. And so we want to help with that too. And one of the things that we're doing in conjunction with Mountain View Hospital is we're developing a brand new EMR, electronic medical record. And out of all of the equipment that we've purchased for this new hospital, this is one of the most expensive pieces. But it has a lot of facilitations for that kind of information sharing between the healthcare facility, the doctor, and the patient. And it's a great opportunity for patients to keep an eye and be involved in their care. It's a great way for them to take their records with them and to be able to have that available to them on their smartphone or at home. And Mountain View Hospital is also developing another service line to help people that maybe should be inside the healthcare system but aren't. In a way where they can facilitate good quality health care. Unfortunately, a lot of times you only see people in the hospital when they're sick. And if you don't get to them in time, they can be very sick. But if we can be smart about it and be preemptive about it, we might be able to cut down on hospital stays and decrease the effect of being sick on people and maybe find things a little bit earlier.
Yeah. There's been a lot of talk nationally about the rising costs of medical care.
Yeah.
What are some of the things that community hospital plans to do to maybe combat that? I know you mentioned the one where if you can get preventative treatments beforehand, that's going to save you in the long run.
That certainly helps, yeah.
But that can be an issue sometimes with insurance companies too. They won't cover a gym membership or whatever, and I don't know, that might be my personal thought of maybe pay for a discounted gym membership and go work out 10 times a month, and that could help your heart,
Right.
But anyways, from a hospital standpoint, what are some things you see that might be able to help reduce the cost of medical care or help the patient be more willing to handle it?
Sure. That is definitely one of the goals that we have at Idaho Falls Community Hospital, is to offer a very high quality care to the patient, but try and maintain that cost down. And in that vein, we have, no pun intended, in that vein, we have worked very hard with insurance companies to try and develop good plans that are of benefit to the people of this area. We've tried to find different ways where we can offer higher access to good quality medical care with trying to maintain those costs. Providing health care is incredibly expensive. To be able to build this building was $116 million. It's a very complicated building that has some phenomenal attributes, but with every little bell and whistle you get on your smartphone, the more they can charge you for it, right? And so the building is kind of that way as well, and the equipment that we need to provide this high quality healthcare is also expensive, and so we want to be able to acquire all of the tools that we need for the physicians in this area to be able to take that quality of care of patients that we want. But our goal is to take care of the community. Our goal is to be able to provide a good option in this area. Our goal is definitely to try and help maintain or lower prices for health care in this area. And so that's something that we work on every day, is how can we look at cutting our costs so we can pass that savings on to everybody else.
Yeah. And competition's good. So
Absolutely.
having another hospital here could hopefully help with that. Let's talk a little bit about mental health. It seems like over the past few years there has been at least a more focused look at mental health issues, which
Absolutely.
for a long time have kind of been overlooked in many aspects of society. How is Community Hospital planning to deal with those who have mental health issues?
So that's another great question. We fully expect that we're going to see an increase in that kind of patients over what we've seen on that campus in the past. And when a patient is experiencing any kind of mental health care crisis, it's every bit as important as a physical ailment that needs to be addressed, right? And so we have some very highly trained, very aggressive professionals that are helping us put together a plan where we can intervene as quickly as we possibly can. And if that patient happens to be at a critical area in that crisis where they could possibly be in danger to themselves or in danger of hurting somebody else, we have an opportunity to intervene when it's appropriate, with an opportunity that's not going to require an inpatient stay. And obviously there are going to be times when that's necessary, and we'll facilitate that as well. But the minds that we have that we're working with have come up with a very innovative way for us to be able to work with the emergency room doctors, other local facilities that deal in mental health, and to help take care of them and get them through that high point of the crisis, and possibly be able to receive a more can't think of the word I'm trying to think of. To be able to provide a more concentrated outpatient effort where they have their family or their friends or their support group right there available to help them do that. And if we can, again, if it's appropriate, if we can keep them from being admitted into an inpatient facility and concentrate that treatment on an outpatient basis, there's a lot of good opportunities to alleviate that crisis when it arises and be able to help them not only get past that crisis, but get back into a normal, productive life.
Which is, of course, would be the goal for
Absolutely.
not only them, but the doctors and everyone involved.
Absolutely.
Casey, is there anything that you want the public to know about Community Hospital? Can people come down and walk around and take a look at
Absolutely. It's a beautiful building. We wanted it to be a place that would make people feel comfortable. And talking about our ally in healthcare, Mountain View Hospital, when you walk into that, it feels very unclinical, very warm and receiving, right? And you get great care there. So the clinical is addressed, it just doesn't seem institutional, right? Mm-hmm. The kind of care that we offer at Idaho Falls Community Hospital is a little bit more acute. And it's important that it's a functional, efficient hospital. So it looks a little bit different. When you walk in, you're going to see that it looks a little bit different than Mountain View Hospital. But it's a beautiful facility, and the people that we've been able to find that want to come and work with us and help us build this hospital are amazing. We have found some of the most skilled and most compassionate people to work in that building, and they are extremely excited to be able to offer care there. So yes, if they want to come and take a look around, I'm more than happy to show it off and brag about some of the people there and some of the things that they do.
And have you hired everybody you need to? I mean, did you have to hire a
Heavens, no.
bunch of more doctors and nurses? And
You know, we've got a lot of great doctors here in town, and we've been lucky where a lot of doctors that I haven't had the opportunity to work with in the past have some interest in being able to bring patients to this new facility. And so we have a lot of physicians in this area that are established and have good patient roster that they're anxious to take care of at the new hospital. Staffing has been hard. I wish, just because we built a third hospital here in town, we had another third more nurses, but we have brought a lot of people into the Idaho Falls area from outside this area. That, you know, what we saw is there's a lot of people that went through the education to get the medical training, but maybe at that time a job wasn't available here in Idaho Falls. And so they're excited to be able to come back home and have a place to practice in. And so that's been a good catalyst for people to move back into the area. And we found a lot of good people here also that, that are excited to help open a hospital. Not very many healthcare professionals get to drive past a building with their family and point it out and say, I got to help open that hospital.
yeah.
So there's a lot of really phenomenal people that have signed up and are helping us, but we can always use more.
Well, I recall sitting in the dental chair about a year ago and looking out the window, and that was the first sight I saw of community hospital.
Oh, yeah.
I said, what is that? And the dentist told me, and now here it is, the signs on the building, and
Yeah.
you're getting ready to serve the public. So thank you very much for coming in and sharing with us a little bit about the community hospital.
Thank you for the opportunity. I look forward to seeing people inside the building. I look forward to being able to show you around and show you what it looks like. It looks a little different than some of the sneak peeks you guys have had over the last 18 months.
All right, we'll have to come in and do another story. I hope I never have to spend the night there. I'll come in as a reporter, but not as a patient. Thank you very much, Casey. Thank you for
Dave.
watching. Have a good week.